And now it's being prescribed again to women, like Bronwyn over here, who's only 33 and clearly still of childbearing age. Is Bronwyn safe? Good morning, the time is 10 o'clock, the place is Bristol, and incidentally Mike Scott is still not well, which is why you've got me. During the late 1950s and the early 1960s, hundreds of babies in Britain were born with appalling deformities, appallingly disabled. Their mothers had all taken the drug thalidomide. When the devastating effects became clear, thalidomide was withdrawn, and most of us, like me, thought it had been banished forever. But did you know it's now being prescribed again to potential mothers? I bet you didn't. I'll be talking to some of them in a moment, but first, what have the last 30 years or so been like for the victims of thalidomide? 30 years to the day, I gather, Jeanette, that thalidomide was withdrawn. You've been with us for 29 of those years, or thereabouts. What has life been like for you? Because I suspect in most people's minds, thalidomide victims were eventually compensated and, in a lot of people's minds, let's be frank about it, forgotten about.
It's been hard. It's been a struggle to prove that, although you are disabled, with limitations, that, you know, you've got a brain as well as everything else. But saying that, it's also been a good life, because I had my little girl 5 years ago.
Terrific. And
she's perfectly healthy. So that made up for all of it, but you do miss what you've never had. Just
backtrack a bit for me, because I suspect there'll be many people watching this programme who weren't even around when thalidomide was an issue and was withdrawn. Just remind me, why did your mum and thousands of mums take it in the first place?
Well, my mum was prescribed a course of the thalidomide, or Distaval at the time it was called. She took 28 days, and I ended up with having no arms and legs, and she was prescribed it for morning sickness.
Yeah, and that's what it was for in a lot of cases, wasn't it?
Yes,
for morning sickness.
It was for morning sickness.
Now, as a kid, what was it like for you? You're up in Manchester.
It was hard, it really was. It was regretting sometimes that you couldn't do what other kids could do. Like, even just doing hopscotch or bouncing a ball or things like that. And it was harder than in my teens, when my friends were going to discos and they could hold their boyfriend's hands, or they could smooch dance on the dance floor, and I had to stay on the side and watch.
I'll bet. You found Bob. Good morning, Bob.
Morning.
You got married. And you had this delightful little girl.
Yeah.
Right. Now, problems there, if any?
Yeah, it hit home to me when I was actually fully disabled, was when my little girl was crying at the bedside of my bed in the hospital when she was born, and I had to wait for a nurse, or I had to wait for my husband or my mum, who was visiting me, to be able to pick Kellyanne up. And that was the hardest things that, as a mother, that I could bear, to see my daughter crying. I could not do anything physically for her.
Are there difficulties too? I mean, kids can be... Well, kids have got an astonishing fascination, and sometimes that fascination makes them sound cruel. When Kellyanne brings her mates back to your house, are there problems there?
Not her mates. We had a few at school, didn't we? At the beginning. And they asked you why Mummy hasn't any arms and legs. And you were getting upset at first, weren't you? So what did Mummy tell you to say?
She told me to say, like, do you know, like young men and children and their mummies love those. Well, all I've got to tell them is my mummy loves me, and like your mummy loves you.
Brilliant. Your mummy loves you just like everybody else's mummy loves them. Great answer. Well done. Terrific. Keep it up. Eh? Well done. Thanks very much to you. We'll come and have a chat with you further on. Hi. I met this young lady 4 years ago when she got married, didn't I?
You did.
Now then, there's happiness in everyone's life, and there's, I suspect, some sadness too. There are difficulties, aren't there?
There certainly are.
What's it been like for you? How many years now?
What, since I got married?
No, since you were around. I'm trying to be polite and say, how old are you, right?
29 years.
29 years, right. Yeah. Problems early on?
I was put in a institution from very young, 10 weeks old. So I didn't really know a lot of the outside world as such until I was 17.
When you say an institution, what do you mean?
It was a special school for disabled people.
It was done with your best interest in mind.
That's debatable, but in the times that I was born at, which was the 62s, that was what the norm was.
In a special school, was it easier or more difficult, do you think, for you?
Well, I don't know, because I was only actually in the school. I mean, I've got nothing to compare. Only now, as an adult, I have to compare. It would, physically, it was probably easier because everything was on hand. But emotionally, no, it was harder. I didn't have a family life.
People will remind themselves, most of you anyway, were compensated. Did that help at all?
It caused some problems for some thalidomides. It helped in sort of like getting wheelchairs and cars and houses adapted, etc. And taking us on holiday for people that, you know, parents that couldn't afford to get us together. It was easier in some ways, harder in others.
Young lady behind you. Say hello.
Hello.
Hi. What's life been like for you?
Well, I have to admit, compared to the previous two speakers, I've been very lucky. And I was only in a special school for the first 3 years of my school days, so I do have something to compare my ordinary school life to. And I must admit, if I'd stayed there for the entire period of my school days, I think I might have turned out very different. But as it was, I was mixing from the age of 7 with children who were perfectly able-bodied. And they accepted me, because if they tried to joke about my disability, I simply turned it into a joke as well. That way I wasn't bullied. If anything, I was probably the bully at school. But I'm here with my mother, and she had immediately... I'm the eldest of 3 girls. My sisters are just 2 and 3 years younger than myself. And with them, I've had a very happy childhood, a very happy adult life to date, which culminated, I think, with my marriage in June to John, my husband. And I haven't really got any complaints about my life at all. I've probably done more than a lot of people have done.
Well, good on you. John and Mum, I mean, do you think that, looking at on this, as it were, sort of from the outside, do you think that the world... We've got a creaky camera there. Do you think the world has actually done enough for these people?
Well, it's very hard to say. I mean, the world wouldn't be any better without Simone, I can assure you. She's done wonderful things. I'm very proud of her. I've always loved her from the moment I had her. But it was difficult to see the other two enjoying things that Simone couldn't. I don't think she's been very aware of the tremendous determination she had for doing things. I used to think she wouldn't be able to cope for lots of things, but she was determined and she did them. She's very gutsy. They're all gutsy.
Every one of them in here is gutsy. Let me introduce you to someone I mentioned earlier, Bronwyn, up here. You have seen these lovely people. You've seen their problems. You know what they're caused by. They're caused by a drug called thalidomide, and you are taking it.
Yes.
And you are 33.
Yes.
Why are you taking it,
I've got a
Bronwyn?
rare blood complaint called Behçet's syndrome, which causes severe ulceration of all the mucous membranes, eyes, right the way through to the digestive system, front and back passage. My life was just awful before I took thalidomide. I've been taking it about 3 years, and it's given me quite a lot of relief.
You were in physical pain, severe physical pain.
Yeah.
Continually?
I've had this complaint since I was about 3 years old.
Yeah.
I've taken several different drugs, steroids, all sorts of things over the years, trying to dampen down and make it sort of stabilise, which has never worked, but thalidomide's worked better than anything I've ever taken.
Now, hearing these stories, are you not concerned?
Yes. When I was first told about thalidomide, my first reaction straight away came to mind. I remembered the 60s. I was growing up then. I heard everything on the media, on the television. I knew what thalidomide was. I justified it in my own mind, taking it, I think, by at the time, and I still understand now, that it never actually affected the mums who took it. So I didn't think I was at risk myself taking it. And I think it's the consultant and my doctors, it's their decision for me to take it. They didn't just say, take it on the first day. They sort of think about it. And I think they realised that I was sensible enough that I knew I shouldn't get pregnant taking it. And I sorted that side out of it myself.
Well, you may have met Cameron, have you?
Yes,
Cameron's a
yes.
doctor, and he's not your doctor, but he has patients like you who are taking thalidomide. Now, let me ask you this, Cameron. When women like Bronwyn with this kind of problem come along to you, under what circumstances do you prescribe thalidomide? What sort of checks and balances, or what questions do you ask? What goes on in your head?
Well, firstly, I would only consider using it for a fairly small number of conditions. They're all uncommon. You've heard about Bronwyn. She has Behçet syndrome, which is very rare in this country. And at the moment, I only have 2 patients who take it, and they take it for a different rare condition called actinic prurigo. They are both women. One of them, in fact, has been sterilised, so the issue of pregnancy doesn't arise, and the other one is in her late 40s. And with both of those women, they have had their condition since childhood, and they have had itchy, blistering spots throughout the sunny months of the year from childhood, and in some cases have not been able to go out, really, in the summer without a great deal of discomfort and irritation, and that's obviously been of great restriction on their lives. And neither of those patients were put on thalidomide until everything else that we know can work in that condition had been tried first.
But if you met someone like Bronwyn, who is still of childbearing age, what would you say to her?
Well, I would say to her that the problem with birth defects is an extremely well understood problem. It's not an unpredictable side effect, it's a predictable one. And it can only occur in a pregnant mother. There are, of course, other side effects of thalidomide, and I'll be discussing those equally, and you can ask me about those later if you wish. But somebody who is not pregnant can't have the problem that we've been discussing today.
But no one in the world can absolutely guarantee, let me ask John, another doctor, no one in the world can absolutely guarantee that they won't get pregnant. Now, what do they do if by accident it happens and they're on this unit?
Well, I think every patient is different, and I do occasionally, under rare circumstances, prescribe thalidomide for women of childbearing age. I would want to be sure that it was an intelligent, responsible woman. I'd discuss the issue fully with her. I'd explain to her that she must under no circumstances get pregnant, and we'd have a discussion about the belt and braces methods of contraception, where perhaps you're on the pill and use a condom, or a combination of 2 methods if possible. But as you say, things can happen. I mean, the woman might be raped, for example, and pregnancy can occur. And I would want to discuss with the woman the issue of what she would be willing to do if she did become pregnant under some unfortunate circumstance like that.
What would you wish her to do as a
doctor?
doctor?
Well, I would want her to agree that if by any chance she did become pregnant, she would have an abortion.
Well, now then, that's your point.
Because the alternative is perhaps to have a child very deformed.
Yeah. I don't want this to become an abortion discussion, because that is an entirely different programme, and it's in a sense an entirely different issue, but it's something that has sparked gasps from over here. Disgraceful, says Teresa, and Sue nods her head. Now, Teresa, why do you think that is a disgraceful point of view?
Well, to give a tablet out knowingly that it's caused such congenital malformations, and then to say to a woman, well, we can give you an abortion. They haven't even thought about the feelings and the side effects of having that child aborted.
But his argument, love, is that the people he's given it to with their permission, first and foremost, obviously, having discussed it at length, and to alleviate a condition that is causing them immense distress. That's the first point.
I don't think it's morally right.
You don't think it's morally right? No. What do you think about his advice, were he to offer it, to abort, then? Why is that? Why? It may sound daft to ask this question, but why are you opposed to that?
So are we all to get rid of the human race if things go slightly wrong?
Yeah.
I'm afraid I see that as a discrimination against disabled people.
Yeah,
absolutely.
You're right there.
We have been able to contribute to life, and hopefully people will remember us because of our struggles and the way life is so difficult.
Sue, elaborate on your point. Why is it discrimination?
It doesn't matter what disability you're actually suffering from. To know that you're carrying a disabled child and to abort it, or to have the choice of aborting it, seems very unfair. The victims here are we're not physically the same as everybody else, but we all lead very full, normal lives, and as far as we're concerned, we're normal.
We're not victims, we're survivors, by the way. I class myself as a survivor, certainly not a victim.
But this is a terrible dilemma. John, come back.
I don't think it's discrimination against handicapped people. I think not to use it under these circumstances is discrimination against people who are already born, who already have a very painful and incapacitating disease. There's no alternative treatment, and to tell them they can't have the treatment because of what potentially might happen to some as yet not conceived person is discrimination against that sufferer.
After 30 years?
Well,
because medicine isn't clever enough yet.
So we're spending a lot of money on medical research.
Being spent enough
Right.
money isn't being spent, that's the thing.
Louise is wanting to come in down here on the front row.
Yeah, isn't it right that it's not actually known as thalidomide now, it's actually known as samaramide?
Yeah.
Well, he hasn't. He hasn't changed the name. Is that right? by
I
the way, John?
prescribe thalidomide, and I talk about thalidomide to my patients.
Sure, sure.
Got one other,
Yes,
one
please,
other
sir.
question. You say that you suggest two contraceptions, the pill and the condom. Surely you should do periodic pregnancy tests at the same time to prevent, all right, if, let's say, somebody was raped. I mean, that is a possibility these days, and you had to have an abortion. I don't personally think that is right to have an abortion, but if you did, surely you should have a periodic pregnancy test so that as soon as they find out they are pregnant, be in that minority case of rape or something, you know, something can be done before it gets further on.
Anybody else, apart from the doctor, who supports the view that it's a risk worth taking? Lady on the back.
I do. I'm a mother. I have a daughter who'll be 31 next year. And I agree with the doctors. With extremely safe, strong safeguards, and it should be a decision between the patient and the doctor. There are several conditions that are being treated with drugs containing thalidomide, and I've known about this for quite a number of years. This isn't a new thing at all.
No.
It has been known for a long time.
Yeah, well, it's been known to some people.
Yeah, why hasn't it been publicised then?
You're all right. It has been happening for a while, and it's only recently that most people have found out about it. Well, we're going to talk to some of those people who are being treated for special conditions with thalidomide a little later on, after the break, when we'll also be meeting this chap here, who produces the stuff in Britain, and we'll be asking him why he's taken that decision in just a couple of ticks. Welcome back to Bristol, and let me introduce you to a rare sight, a drug manufacturer live on television talking about his trade. First and foremost, thanks very much for coming in. It's appreciated. You're a family man?
Yes.
Got kids?
Yes.
Yeah. And you're in a pharmaceutical company that now produces thalidomide.
Correct.
Yeah. You cannot have taken that decision lightly.
A very difficult decision. It was one that was taken after a lot of advice from colleagues and professional bodies.
Why did you decide to do it? It wasn't just for the money.
Oh, absolutely. The amount of money we make out of this wouldn't pay for the petrol to come here. So it's not the money aspect.
I think we have to accept his word on that. But anyway, let's carry on. So what was, in the end, your rationale for doing it?
The rationale is that the material that was being... doctors were desperate to get their hands on thalidomide to use for patients who were desperately ill. And the material they were getting, there was some concern over the quality. And I felt that we could do something about that by at least getting the synthesis made, getting the product properly checked out. If we're going to use thalidomide, then let's use the very, very best quality product.
Am I right in thinking that the stuff that was in this country prior to you producing it at your factory, wherever it is, was coming in from abroad?
That's right.
And was not, in your view, of the quality of the stuff that you now produce?
That's correct.
Right. As a dad, and who's been around for a little more than 30 years, having lived through this tragedy, having seen people like Jeanette here in this studio audience, aren't you worried?
My generation, through university, through the training, I mean, this is really what was focused on our minds. I mean, we can't forget this. I wasn't in the industry at that time, but the lesson very clearly remains with us.
Now, we have seen examples, one behind you, of Bronwyn, who's taking it now, and she says it's doing her a great deal of good. There are more I'll introduce you to in a tick. They all think it's wonderful. So did the ladies who took it for morning sickness. How do we know? What guarantees can we have that it's not going to do somebody somewhere harm?
It is not without its own side effects. And it is a drug, I would imagine, that the physicians would use it as a drug of last resort. So it's only used when there is nothing else available that will do the job.
I'll come back to you. Thanks for talking to us. Thanks for being so frank. I want to introduce you to this lady down here, Yvonne. Introduce us to your kids, Yvonne.
This is Liam and this is Sarah.
Liam and Sarah.
Yeah.
Now, why are you here?
6 years ago, Liam was diagnosed with leukemia. 3 years later, he relapsed. He had to have a bone marrow transplant. Sarah was his only chance. She was the donor.
Well done, Sarah.
Because of the blood-related donor, Liam was diagnosed with a disease called graft versus host disease.
Called?
Graft versus host disease.
Right, graft versus host disease.
Yeah, it's where Sarah's bone marrow is actually fighting inside Liam's body. It's guaranteed that you'll probably get this disease once straight after the transplant.
Now, what's the effect of it? It's a very, very rare condition.
Yeah.
We have to make it plain.
Well, the first time you usually just get a skin disorder, which can be not very nice. But 9 months later, Liam was signs that the disease was coming back again, the graft versus host. This affected all his skin, his joints. He cannot walk, and there is a lot of things that he cannot do.
His joints seize up?
Yeah.
But he's now on thalidomide?
Yeah, 6 months ago, he was on the usual drugs. Nothing was touching this disease. It was just getting worse and worse. By the summer, you know, things were looking bad. 6 months now he's been on thalidomide, and there are signs now he's getting better.
So you're a fan?
Yes,
right.
I am.
Thelma, you're a fan. Why are you a fan?
I'm a fan because I tried all sorts of drugs and went to all sorts of different people and nothing worked.
What was your problem, love?
Ulcerated mouth, continual ulcerated mouth. And this was the end of the line for me. And I think it is strictly monitored. What I like to say also is that the doctors are responsible for this drug. So they're not just going to give it out willy-nilly. Because at the end of the day, they can be sued.
Hang on. Yeah. Right Honourable Member for Whittington, isn't it? Withington, I'm sorry, I ought to know. I come from Parliament. Withington in Manchester. And a friend of Jeanette here and Bob. Right.
That's right.
Given these success stories, what's wrong with prescribing thalidomide in these controlled circumstances?
Well, our position was exactly the point that the lady has just made about it being willy-nilly being used in this country. So we sought a meeting with Virginia Bottomley, the Minister of Health, to find out exactly what guidelines were being issued, because, like you, I was shocked that it was back on the market being prescribed, and not under the name of thalidomide, so that people would be aware precisely that it was thalidomide that was back being used. And we wanted to know what the Department of Health were telling consultants who were prescribing it, and seeking assurances about the regime for those patients.
What did she tell you?
Well, what she told us was that there were strict guidelines, that the consultants were using it only on named patients, and that there would be strict monitoring of what was going on. But what we are concerned about was to ensure that those guidelines were actually being translated into action by the consultants, to ensure that they were following the guidelines, that any women, particularly of childbearing age, were being properly counselled about the side effects. And we gave further suggestions, as a colleague has just mentioned, about particularly monitoring pregnancy throughout the period that is being followed, because often the regime can be for many months, and you have to ensure that throughout that period that the people who are being prescribed it are being properly protected. Because our position was not to ban it in these specific cases, because as Jeanette, I think, said at the meeting, and very movingly, that if something good can come out of the previous tragedy, then that shouldn't be denied. But those safeguards, and we have now sought meetings with the consultants to ensure that what the Department of Health is saying in theory is being translated into practice on the ground with these named patients.
OK. Has anyone any evidence that these guidelines aren't being adhered? Lady on the back.
Well, no, what I was going to ask was, if the use of this drug increases, how lax are the doctors or consultants going to become about informing patients that they're actually taking thalidomide?
We have been told, actually, that the use is proliferating. This was by a consultant using it, that one of his worries was that the use is proliferating.
Gentleman on the back has been waiting a long time.
Yeah, that drug was banned about 27.5 years ago.
30 years, actually.
Well, no.
Anyway, go on.
Can you tell... can you tell me which is the difference between withdrawing and banning?
Well,
because if it's banned, you're not allowed to use it anymore.
No, it was withdrawn. It was voluntarily withdrawn.
It wasn't. If most of the parents...
It was not banned. Take my word for it. It was not, otherwise it would be back on the market.
Well, we've been misled by the government.
We have all, me included, misunderstood the situation.
Most parents was at a meeting in London. They said it was banned.
No, well, right? Take it from me, it wasn't. John?
The question of whether the consultants are likely to be lax in using it is a very good one, but I think you have to remember that the person who carries the responsibility for prescribing this is the actual doctor who signs the prescription, not the manufacturer. I'm sure there can't be any doctors in the world who don't know that thalidomide is bad news and can cause deformed babies. And if they use it wrongly, they are the ones who will end up in court and paying out large sums of money.
We should explain this, John, because I didn't realise this until just before we started the program. I was talking to you. I'm correct in saying, am I not, Roger, that this product at the moment does not have what's called a product licence. It only has a...
No, it doesn't carry a product licence at all. But the quality of the product and the protection of the public are presented by the fact that it's manufactured by people with manufacturing licences.
Granted, no one's disputing that. It has... What's the licence it has?
It is being made under a manufacturer's licence, not under a product licence.
Am I correct in saying, Roger, that that means, because it's only got this manufacturing licence, if anything were to go wrong, and God forbid, but if anything were to go wrong, the victims couldn't sue you, the manufacturer, they'd have to sue him, the doc.
No, that's not exactly correct. If the problem was due to a defect in the actual drug itself, i.e. it had been made wrongly, then the manufacturer would be liable.
But if it hadn't been made wrongly...
If it had been made correctly, then it would be the prescribers, yes.
So you'd be in the dock?
That's right, and we're willing to take this risk because we are faced with the problem of these patients who have absolutely horrendous clinical problems that we can't treat in any other way. We've tried innumerable drugs, sometimes drugs with quite severe side effects like prednisolone. These sometimes are life-threatening conditions. The patient will die unless we do something.
The young lady's not been in. How do you feel about this?
Yeah, I'm just wondering, did anybody, medical profession, stop and think when they were thinking about thalidomide? Did anybody stop and think, what about the victims of thalidomide? Did anybody stop for 1 minute and think, you know, well, we're dealing with thalidomide, and it still is thalidomide, whatever other name you call it, it still is. Did any medical person stop and say, well, how are the victims going to react? Or did they just...
Let's ask the victims how they react. Supposing you had a young lady of 30, she'd got large ulcers in the mouth, about 1 centimetre. She couldn't eat, she was losing weight, she was dribbling.
Think of any
ulcers in the vulva. No, we've tried the alternatives, they don't work.
I mean, could you not plough money into sort of finding alternatives?
Hang on, I've got lots of people here. Young lady there first, and then this young gentleman on the back. Yeah?
My views probably differ a lot from the other thalidomide victims sat here and their parents. We've all suffered, however much or however little. But, I mean, you can't ban it full stop. I mean, my views are, if you ban it full stop, I mean, what about the men that are suffering? What about this chap here? He's not going to have a baby.
Yeah, sure.
And he's suffering relief from taking it.
Sorry, I'm not trying to stop you,
No.
but I'm also mindful I've got a lot of hands up. Gentlemen, yes, sir.
How can this man be selling an unlicensed drug?
No, it's not unlicensed. It is licensed. Let's make that absolutely plain. He's doing absolutely nothing improper. And it's a fine argument about the licensing, but it's a legal thing.
What can you say? I mean, we live it, and you're ready to get it to live again, you know. Why?
Sorry, may I come in here? Are you suggesting that we do not manufacture this drug anymore and therefore not make it available for anybody?
There must be an alternative.
Yeah. Well,
there are millions of pounds pumped into the drug industry every year. Oh, there aren't. I mean, while you get fat on the profit.
No, let's be fair. First and foremost, he's very brave to come in. He's saying he's not making a massive profit out of this. He's not making a big profit out of it at all. One quick last word. Go on.
I've been taking drugs for 25 years, different drugs, steroids, colchicine, and several of those drugs have had warnings about not getting pregnant on them. Apart from thalidomide, I've taken risks several times on other drugs.
Cameron?
I think that's a very important way in which we should broaden the discussion here, that there are a lot of drugs in common usage for important conditions that have exactly the same risk or a very similar risk for producing abnormalities during pregnancy. And such drugs always carry a warning, and of course the thalidomide saga really got that known to the public.
I'm going to pause you there. We'll carry on. I'm sorry. I've got to say bye because our time is up, and tell you that don't miss tomorrow's show. We hope Mike Scott will be back with you. Don't watch it because we're going to do a show about toys, dangerous toys, potentially lethal toys that you could, unless you're careful, buy for your kids. So please watch that. Please watch that. Let's carry on. You're going to say, Sue. Go on.
I was going to say, why do you not have to sign a disclaimer? Some of these drugs, they make you sign a disclaimer.
Well, in some situations we are encouraged to do that, that's true, but as you've heard already, when we're prescribing thalidomide, we're on our own. So the company in the background is actually not so relevant. It's us that have the responsibility.
So if you're taking the risks, you're the people that are deciding to use it, why can you not guarantee to us it won't happen again?
30 years ago,